What do your members want to achieve with today's industrial action?
Well, they want the Premier of New South Wales and the Government of New South Wales to put in place nurse-to-patient ratios on a shift-by-shift basis. We want to see that the midwifery staffing is also given the benefit of ratios so that our members, nurses and midwives, can deliver the best possible care to the community of New South Wales. They are also calling for a decent pay rise and recognition of the work that they have been doing throughout COVID-19. And they want to continue to have the protection under workers' compensation, where if they catch COVID-19, then the presumption is that they get it at work. Currently, the government's intending to try and remove that provision from workers' comp. And, of course, the government has simply said to us, we'll have talks with you about what your claims are. We've been having talks for 10 years and every talk that we've had has ended in a big fat no. The thousands of nurses that went to the streets today sending a very strong message that no is no longer acceptable. We want to deliver the best possible care to our patients in New South Wales, and our current system has failed us.
The Industrial Relations Commission ruled late yesterday that the strike action should be abandoned, and yet you pressed ahead with it. Should you be taking nurses off the job while we're still coping with the effects of the pandemic?
Well, the unfortunate thing is that the government can use the Industrial Relations Commission to try and silence nurses when they've got a responsibility to speak up and tell the real situation loud and clear to the people of New South Wales, and loud and clear to the Premier and the Minister and all of the Cabinet who make decisions about our health services. They have relied very heavily on absolute dedication of nurses and midwives. It's been carried very heavily by our members throughout COVID-19, and they've come to the end of their tolerance. They can no longer look forward to poor staffing levels, no guarantees that when they walk onto a shift that there will be adequate staffing there to look after the patients. They are simply over that. And we certainly fear that unless there is hope for the future about a better staffing system, then far too many of those wonderful nurses and midwives will be walking away from those professions, and our health system will deteriorate into a much worse position than it already is in.
While the strike goes on, Brett, what plans are in place to keep hospitals running and patients safe?
Well, while we had thousands of nurses who were outside the hospitals, of course there's 10,000 inside the hospitals. Still, voting in solidarity takes strike action, but remaining behind to provide life-preserving care. There's no doubt we've seen massive shortages of staff as a result of the decision of the government to open up in December, despite knowing that Omicron was heading into our communities. And nurses have paid the price of that decision by government. They've worked short-staffed 4 months on end, and they've been expected to go not the extra mile, the extra 100 miles in terms of trying to meet an unreasonable, impossible demand being placed upon them as a result of government decisions. So the nurses want the government now to make a decision that says, we do really care about you. We don't just want to say platitudes. We will work with you to fix the system, to make it such a system that people will want to stay, that we will be able to recruit people into the health system. If we lose so many of those experienced nurses and midwives, which we've already lost too many, then our health system will crumble. You can't keep asking people to do the impossible and expect that they're going to keep turning up to work. And today was a very good demonstration of they've had enough. They want the government to act now.
Brett, have you heard from the state governments during the course of the days so far? Are there more talks scheduled? And if you don't get what you want, will there be further strikes?
Well, yesterday the Minister had an hour's discussion with a number of our members and ourselves, and he didn't seem to be aware that the Industrial Commission was waiting on whether he could offer any hope that would have led to a different decision. He has agreed to continue to talk, but he seems incapable of understanding that ratios on a shift-by-shift basis is what the outcome that our members want. And that's, a system that's been in place in Victoria for 20 years. And as far as I can see, Victoria hasn't died under the weight of it. And Queensland has also legislated nurse-to-patient ratios. The Australian Capital Territory is introducing it. Why is New South Wales so backward?
So further strikes on the cards?
That's always entirely up to our members to decide, but they have set a very strong expectation today that they're not satisfied and that they're prepared to continue to stand up and be heard.